Hello and welcome to this webinar. In this webinar, we'll be talking to you about supporting children's mental health. Please feel free to pause, rewind, or revisit this webinar as necessary to allow yourself a comfortable listening. The aim of this webinar is to understand what mental health is and why this is important when considering children. We'll be looking at how we can support children's mental health and overall well-being during the current coronavirus pandemic, how we can support them whilst we are now gradually coming out of lockdown, and ultimately how you can assess the mental health support and treatment that might be required and what support services are available. So let's start by defining what is mental health. Mental health includes our emotional, psychological and social well-being. It affects how we think, feel and act. It also helps to determine how we handle stress, relate to others and make choices. As a society, we must take a lifelong approach to viewing mental health because good mental health begins at infancy. According to the World Health Organization, 20% of adolescents may experience a mental health problem in any given year. 50% of mental health problems are established by age 14 and 75% by age 24. And 10% of children and young people aged 5 to 16 years have a clinically diagnosable mental problem. Yet 70% of children and adolescents who experience mental health problems have yet to have the appropriate interventions at a sufficient early age. The evidence clearly shows that identifying the signs of ill mental health early and providing the correct level of support is very important. Most people recover from ill mental health, and this is more prominent in those that have been given the support at the right stage. News about the coronavirus pandemic is everywhere, with schools still closed or partially open and many people constantly exposed to digital media. It's no longer possible to completely control the news that we consume or to shield children from upsetting information. What you can do to help is minimise the negative impact that it has on your children. You can do this through open and honest conversations at home. So what can you do to support them? Start by acknowledging that it's okay to be concerned. This is an unprecedented time for many of us. Children are very likely to understand the uncertainty that you as a parent or guardian are exposed to, or to hear stories that are not expressed in an age-appropriate way. Go through all their concerns and questions with them. Rather than well-meaningly dismissing their feelings by telling them everything's fine, try sharing with them that you also find events like this worrying. Let them know that you can balance up these worries with the knowledge that they will likely not come true. You want them to leave the conversation realising that although bad things can happen, many people, including world-leading experts, are working very hard to reduce the impact of the pandemic, so they don't need to be scared all the time. Try to be careful not to have conversations about your fears, particularly relating to deaths, serious illness, or worry for friends and family within earshot. Children pick up on more than we realise, and they may misinterpret or keep their feelings hidden from you. Be honest and open with children. If children have access to clear and honest explanations of what is happening, then they know it's okay to talk about the pandemic. No matter how scary, then it can give them the confidence to reach out to you. All children, even teenagers, want to know that their parents can keep them safe, or guardians. The best way to communicate safely is by talking about worrying news with open, confident, clear and truthful facts. Talk to them about what they can do to look after themselves and others, explaining the importance of hand washing, for example. It's also a good opportunity to talk about the benefits of kindness. Remind them that bullying is also wrong and that we should each do our part to spread kindness and support to each other. To avoid overexposure, encourage them to discuss the news with you once they've read about it. This provides a safe space for all their questions. If you don't have the answers, be honest and try reading or watching reputable news sources together. that you have already previewed, or share the news in the moment by explaining what is happening verbally in an unbiased way. Check in with them regularly to ask if they are discussing the pandemic with friends, especially if they have access to messenger apps, and stay in touch with school friends. Reassure them that they can ask you questions. Explain to your children what it means to be vulnerable. Vulnerability is not weakness, it is a natural response to experiencing uncertainty and risk and being emotionally exposed. You may be feeling vulnerable as a parent or guardian in having this conversation with your child. Try to acknowledge this and offer them a lot of time for discussion and support with you. You can use this as an opportunity for teaching children to grow into responsible adults. Abiding by the measures, such as not going out and gathering with other people when not necessary, means understanding that there is something bigger than ourselves and that we should protect each other. Limit the news intake. Small doses of real-life news from trustworthy sources are really helpful. However, lots of exposure can do harm, because children can become fixated on a news story and repeatedly look at news coverage relating to it. The important thing here is to find balance. Force-feeding news to children, or on the opposite side, going to great lengths to hide it or shield them from it, can be unhelpful. Avoid turning the television off or closing web pages when they come into the room. This can spark their interest in knowing what's really going on, and that's when their imagination can really take over. Keep children healthy and active. Children and young people should be active for about 60 minutes a day, which may be more difficult when we're all indoors. It's important to try to build activity into kids' daily routine. Plan time outside, making sure to follow the government advice on social distancing. There are lots of indoor games and activities for kids to play on the Change for Life website, for example. We know it can be tempting to give sweets or chocolate to cheer your children up, but too many treats are not good for their health, especially if they're not as active as they normally would be. Sleep is so important for the mental and physical health of everyone. Children and young people need good quality sleep, so it's important to keep existing bedtime routines. Keep close and in regular contact. Try to keep your children close to you or those who care for them, as they will need that closer contact now more than ever. If you are not living with your children or must go away or to work or to a hospital, keep in regular contact by phone or video calls. If the children are part of a family that is separated, it's important for them to be supported in their contacts with parents or other family members, even when adults do not always get on. Help them understand any arrangements that have been or are being made for them. Use simple terms they understand so it's clear why these things are happening. Create a new routine. With everything happening at the moment, it's likely your normal routine has been disrupted. For most children and young people, certain routines like going to school have stopped or changed significantly. Routines make children and young people feel safer, so think about how to develop a routine that is interesting and fun. Make a plan for the day and week that includes time for learning, playing and relaxing. If your child or the young person continues to be learning from home, ask teachers what you can do to support them. Explore online educational resources and activities like BBC Bite Size. You can even arrange a virtual play date with friends or visit an online museum or gallery. During times of stress and crisis, it's common for children to seek more attachment and be more demanding on parents. Discuss COVID-19 with children in an honest and age-appropriate way. If your child has concerns, addressing them together may ease their anxiety. Children will observe adults' behaviours and emotions for cues on how to manage their own emotions during difficult times. Remember to take care of your own mental health and well-being. You will give the best support to those around you if you can deal with things calmly and confidently. You can be more supportive if you're able to be prepared to deal with any issues. There are things you can do and support is available on looking after your own mental health and well-being during the outbreak. You and your child may be feeling excited about easing some of the lockdown restrictions, but it's also normal for children and young people to feel worried or anxious about transitioning out of lockdown. We've all experienced significant changes to our daily lives and routines, and we're living with lots of uncertainty about the coming weeks and months. During lockdown, we've had to stay home for long periods of time, and we've been instructed to keep our distance from others. This is a change, and you may have to become very aware of keeping yourselves to yourselves and keeping others safe. It can be worrying. As some lockdown measures begin to ease, some children and young people may find it difficult and may find it takes some time to adjust. Explain the changes of the lockdown restrictions. Find out how they're feeling, what they're thinking about. Let them know that it's okay to feel scared or unsure, and try and answer the questions and reassure them in an age-appropriate way. Remember, you do not need to know all of the answers, but talking things through can help people feel calmer and provide them with reassurances. Get your child to reflect on how they're feeling about having closer contact with some other people and going outside more. Get them thinking about what this means and what's right for them, and prepare them for the fact that people may react differently to meeting up. Remind them of the rules that are there to keep themselves and others safe, and that they're not there forever. Things will eventually go back to normal. Spend quality time doing things and activities with your child, such as reading, playing, painting or cooking, to help reassure them and give them a break from any worries they have. This is also a great way of providing a space for them to talk through their concerns without having a big chat. Keep as many regular routines going as possible to help your child feel safe and secure. Remember that this is a gradual process and that your child may need some time to adjust to the new situation. If your child is feeling worried or overwhelmed, arrange catch-ups with family and friends on a smaller scale at first, and start by making smaller trips outside the home. Now we've looked at how we can support our children throughout the pandemic and ultimately whilst gradually coming out of lockdown, what can you do if you think your child needs support for their mental health beyond what you may be able to provide? If your child is already being treated by a mental health team, get in touch by phone and the service or key workers to discuss how their support will continue. Many services will be offering online or telephone support in place of meeting face-to-face, so this is something you can ask about. If you think your child needs emotional support and would benefit from starting therapy or counselling while the pandemic is happening, it is possible to arrange online or phone sessions in place of face-to-face. Your child can still access emotional support from helplines, text lines and online chat services anytime they need to. And Childline, Samaritans and Young Minds Crisis Messengers all provide 24/7 support. The mix is also good for providing online and phone support as normal. You can find organisations offering support for young people around specific mental health issues such as anxiety, depression and self-harm on Young Minds, and there's a parent's guide to support as well. If you're worried about your child's mental health and need professional support, contact your GP. In line with the NHS advice, avoid going to the GP surgery in person if you can. To speak to your doctor or book an appointment, you can phone the surgery, use their online contact service if they have one, or visit the website to find the best way to get in touch. Ultimately, create your own routine and make sure that you reconnect with your child as their parent or guardian. It is difficult when you've been the babysitter, the parent, guardian, teacher, and friend. Reconnect with how you were previously and what good things you can take from this. I would like to thank you for watching this webinar on supporting children's mental health. I hope you found this enjoyable and informative. If you need any support or have any questions about the topics raised, please feel free to use the support available through our portal and app. Alternatively, you may be able to contact our counselling and advice helpline, which is available 24 hours a day, 365 days a year. Thank you again for watching this webinar.